I'm Lila Lazarus. It's the perfect storm for anyone with a bad habit: boredom, anxiety, social isolation. And if that bad habit is vaping, scientists, health advocates are especially concerned. Dr. Vida McCabe has been on the front line of this outbreak. She's the Chief Wellness Officer at St. Joe's and Mercy Health. First, Dr. McCabe, thank you for all that you're doing. Tell us what you're seeing. Tell us what it's like on the front line.
We're seeing that people who come in with histories of smoking and vaping appear to have worse outcomes. It's hard to tell because we don't have the data completely compiled, and really you're going to know that more retrospectively if people are compiling those histories.
Now, we know about the high-risk groups for COVID-19, the elderly, the people with lung disease, heart conditions, immunocompromised, thing you can't really do anything about. But when it comes to vaping, this is risky behavior you can do something about.
We know that vaping is highest in those late teens, early 20s, and some 30s. And if those people can stop vaping, they're going to set themselves up for lower risk. There is criticism to say that those studies haven't been done, but it's a little bit like having a new type of stove with a new burner. It's common sense to know not to put your hand on that burner if it heats as high as a flame stove. And so what we know with vaping is it does, in animal studies, inhibit the immunologic response. We know that people will then have higher rates of bacterial infection. We know that vaping coats the inner airways. It's not actually a vapor, it's an aerosol, and it'll inhibit your body's protective way of getting things out. And vaping and having the misfortune to get COVID-19, it's a little bit like starting an ultra marathon after you've already run a marathon. And so it's time to quit.
So you really think, especially with that marathon analogy, that this predisposes people to a worse infection when they're exposed to that virus?
I do. I think it predisposes people to a bigger inflammatory response and a higher risk for a superimposed bacterial infection. When your lungs can't oxygenate or ventilate because of this inflammatory reaction, typically people need ventilatory and oxygenation support, and we put them on a ventilator. The problem is the body has a capacity for that, and when you exceed that capacity and the lungs are stiff, and instead of being like fluffy goose down pillows, they become wet sponges that have been bathed in wet concrete. There's not much you can do beyond that.
You have been warning about the dangers of vaping for months. What do we know about the undeniable dangers?
We know that vaping coats the airways. We know that it is an unregulated industry in the United States. We don't know what's in the e-liquids. We also know that a third of the e-liquids that say there's no nicotine in them do have nicotine. The previous vaping-induced lung injury that we saw in August and September has cooled down, but now we have a new bad actor in our healthcare system. And so we don't want to bring those two together.
So when you talk about this bad actor, this combination of COVID-19 and e-cigarettes, tell me what you are already seeing in the hospital.
No, we haven't studied this officially, but the young people seem to have higher rates of vaping that are coming into the ICUs and being put on ventilators. And we know that this disease is taking out young people as well as older people who are at high risk. But I would consider vaping a high-risk category.
I did just read a story about a 21-year-old patient out of state who now says he wished he had stopped vaping because he's alone in the hospital with pneumonia and on oxygen support. Does this surprise you for a 21-year-old?
No, not with the history of vaping. The problem is when we're young, we feel pretty invincible and we think that these things are all reversible. The reality is lung injury is not all reversible. And we know because we had the first case also in the Michigan area pre the COVID epidemic who received bilateral lung transplants as a result of vaping. And he's been very vocal on social media to share his story. And this is another great story. And I know the scientific community says, yep, these are stories. And in large part, the people who criticize his story are the people who are funded by the tobacco industry, who owns all the vaping companies, or there's some criticism out of Great Britain. Great Britain is a different story because it's a regulated industry, so you can't compare the United States to Great Britain.
We do know that 40% of those hospitalized are between the ages of 20 to 54, and that half of the positive cases in California are under the age of 50. So what's the number one message you want to get out?
Wash your hands, practice social distancing, and stop vaping and smoking. And take care of yourself and your family.
There was a study in the Chinese Medical Journal that said they studied, I think, 78 patients with COVID-19. And they said those with a history of smoking were 14 times as likely to develop pneumonia. Does that ring true here?
The mechanism's the same. So with smoking, we injure the little cilia inside of our airways so they can't clear secretions and bacteria. Vaping is a little bit like inhaling hairspray that you're spraying in, and it coats everything. And so we know it's toxic to the cilia. It's going to be the same mechanism. I don't think you need a randomized controlled trial to show that putting your hand on a hot flame is going to burn it. You just need to practice a little common sense. I know how hard it is to quit smoking. I'm a former smoker. And there is help. We can help people quit vaping. We can help people quit smoking.
I like that you're honest about the fact that you're a former smoker. People think, even to this day, that vaping is the healthier alternative. Can you clarify that?
Vaping is an alternative. I want everyone to remember that in the 50s and 40s, when filters came about, we said, oh, it's the healthier alternative, right? All the commercials, all the ads, they had doctors in those commercials and nurses, surgeons. And what we found out is that we changed the type of cancers people get from central, large, bulky cancers to more peripheral at the edge of the lung, round cancers that tend to like lymph nodes. We went from squamous cell carcinomas to adenocarcinomas. I believe that over the next 10 to 20 years, we're going to see a reversal of that, going back to more central, bulky tumors that can be very hard to resect because of their size. And in large part, because we're doing the same thing, we're coating the central airways in these toxic liquids. We know there's carcinogens in the vaping e-liquids. We also know that there are small nanoparticles that also appear to be crossing the blood-brain barrier, as well as other areas. Some biochemists are postulating that potentially there might be a link later on to early Alzheimer's. It's hard to know.
Talk about the aerosols that come out of vaping and what they may do to the pulmonary cells.
What they do is they shut them down so that we can't clear infections. And although we have no evidence that the virus will get transmitted, what we do know is it's the superinfection after the virus with bacteria that people can't clear. For every day you're put on a ventilator, there's a 4% risk of a ventilator-acquired pneumonia. And if you can't clear it, if you've inhibited the body's ability to heal from that and the proper immunologic response, it's really hard for antibiotics to work. Without that response, what we get is this incredible inflammatory reaction, and people can't oxygenate or ventilate, meaning blow off their CO2. Both are problematic. If your heart's the engine to the bodies, the lungs are the gas tank. And so with vaping, what you're doing is you're running on red on your gas tank.
And for those smoking pot, can you give us an honest answer? What that's doing to the lungs?
We know it's the combustion of things that causes carcinogens. There's not a lot of data on pot. There's a very active pro-marijuana lobby. There are no good studies, from my perspective, showing it's healthy or good for the lungs. And so I don't think this is a time to be smoking pot or marijuana. How people take it other ways, there are other consequences. We know that the current type of THC marijuana cannabinoids out there are significantly higher concentrations. They're more toxic even to the GI cells. So we're seeing far more nausea and vomiting that's long-term, 2 to 3 months after stopping with marijuana use than we did 10 or 20 years ago.
So you're saying the most important message here, if you vape, now is the time to quit. But in all honesty, people are alone, they're frightened, they're bored. It seems like a very difficult time to quit. How to do it?
It takes a couple of things. One is if there's nicotine in the vaping product, get on a nicotine replacement therapy or call your doctor. There are some pills that block nicotinic receptors that really help. The chance of quitting cold turkey over 6 months is about 4%. If people use best therapy with coaching, with medication, that can be anywhere from 16 to 30%. And we count in terms of 6 months. Every time somebody tries to quit, it takes on average 4 to 8 quit attempts. So if they quit and fall off the wagon, that's okay. It's a practice run towards getting across the finish line. In addition to calling your doctor, buddy up with someone. Ideally, you buddy up with someone who's quit before. And typically what I tell my patients is carry a card with 5 people's names and cell phones on them. And when you want to vape or smoke, give them a call and just talk it through. Give yourself 20 minutes to hold off. Change your habits. If you're used to getting out of bed and grabbing a soda pop and vaping or a cup of coffee and vaping, change it up a little. Go for a walk, come home and get a green tea. We know neurobiologically it takes about 90 days to change our rewiring in our brain. And so know that, and it's not forever. The other thing that's always helpful to people is just quit for one day at a time. Quit today and tell yourself, tomorrow I'm going to smoke a whole pack. And that way you can keep deferring the tomorrows till you get that 90 days worth to really start changing the behaviors associated with it and to overcome the nicotine withdrawal, especially if there's nicotine in the vaping product or in the cigarettes. Withdrawal typically is a process that lasts about 2 weeks. It peaks at about 4 to 7 days. The other thing that's interesting, it takes 90 days for our cells to normalize their nicotinic receptors. That 90 keeps popping up. It's a magic number.
So usually our hospitals provide these smoking cessation resources, vaping cessation resources. In this time, in this new normal, what resources are provided?
In our health system for the cancer patients, we have directed coaching for those patients so they're not getting a triple whammy. Your primary care doctor can certainly call in prescriptions, and there's delivery services for those prescriptions.
Great. If you vape, there's no better time than right now to quit. Dr. Vida McCabe, I can't say it enough. To you, to the doctors, the nurses on the front line, you are remarkable. Thank you for talking to me. If you're between the ages of 18 and 40 and you're still thinking you don't need to be concerned when it comes to COVID-19, keep this in mind. Low risk doesn't mean no risk. I'm Lila Lazarus.